Matthew Holt with Adnan Iqbal. He is the CEO of Luma Health. Adnan, what does Luma do?
So Luma is really focused on unifying and automating all patient journeys. So that's operational, clinical, and financial. And the goal really is to help our partners, health systems, hospitals, clinic networks, deliver an end-to-end seamless patient journey for their patients, ultimately their customers.
Okay, so does that mean you're sending messages to patients? How are the patients getting involved? How do they figure out that there is a thing where they can get a message from whichever health system you're working with?
Yeah, absolutely. So we're truly omnichannel. Text, email, voice. We'll power apps for health system. And then, of course, web-facing chat. So we just launched LumaBot today. That's all things web-facing. Really what we found is text is best. It works phenomenally well across age group, demographic status, socioeconomic status, etc. We see about a 65% plus response rates across the US. And of course, the power of this is it's truly multilingual. So it's a solution for 100% of Americans. You get 30 languages out of the box. So text is best, but it's that ability to not just message a patient, but to help orchestrate their entire journey. So knowing what type of message they need, when they need to be nudged back into care, what their diagnosis and care plan is, so you can effectively guide them before, during, between, and after a visit.
All right. So how does the hospital group sort of identify? So are these people coming in the sort of front door looking for help? Are they people being directed by their doctor? What's that sort of onboarding funnel to your system?
So D, all of the above, right? In that here's your electronic health record, that is your system of record. Luma Health sits on top and deeply integrates, right? We have the deepest set of integrations, and we integrate with 80 different electronic health record systems. And so we become your system of action, right? And if it's a person, and I use the word person on purpose, not patient, lands on a website and is engaged with one of our bots, and they want to be able to get to the right care, or have some symptom checking, or have a financial question answered in terms of what will this cost me, that's all possible. And then of course for patients, whether they're referred in, or they're an existing patient, whether they're a follow-up patient, because of the depth of our HR integration, we're able to guide that patient effectively, given what it is they're looking to achieve. Reschedule, schedule, have a question answered, pay a bill, learn more about screening mammogram they're referred to, etc.
All right. So for the hospital systems that are out there now, let's start with that. So how are you doing in terms of how many clients, hospital systems, and then the next question to that is how are hospital systems doing in general with this issue? But tell me about Luma. How many hospitals are you working with?
Yeah, so we are following your classic kind of triple, double paths. We've been doubling year over year. Today we work with a little over 600 customers. That's health systems, hospitals, regional networks, and clinic groups all across the United States. We have roughly 175,000 providers. That's doctors, nurses, PAs, medical assistants, etc., who engage with our platform in some shape or form.
All right. So ballpark for big hospital systems,
yes.
What share do you have? And then ballpark for big hospital systems, what share of them are doing something like you? How's that market going?
Yeah, so I'd say that's the big shift we've seen is health systems have all now really started to shift to demanding and really wanting to have a desire to own and automate the entire patient journey, right? So I think patient engagement is a pretty stale term, and I hate the word engagement. No patient wants to be engaged. You really want to be helped and guided, but patient engagement went from messaging, right, to then digital front door, and now folks are even beyond that and looking at it as like, what is a digital continuum? Like, how do we evolve from being a healthcare organization that's engaged in digital transactions to actually being a digital company that is delivering care in the new normal, for lack of a better word? And so I'd say that is true across the board. Where a health system is on their own digital transformation journey varies, but I'd say the vast majority of folks are looking for digital front door right? And so of that market share, we now work with say 30 to 40 of the leading enterprise health systems across the U.S. Includes academic medical centers, Catholic health systems, county public health systems, regional health systems, and of course standalone hospitals of different shapes and sizes.
All right, so let's talk about what that means for Luma. You guys raised a chunk of change last year, what, 120?
We raised $130 million Series C last fall.
And you were at about 150, 160 overall, I forget how much.
$150 million in capital in total raised to date.
Okay, and tell me, how, in terms of people, how many now? You presume you've grown a fair bit with that money. I assume you spent some of that.
Yes. We're welcoming a little over 45 people into Luma here over the past few months. So we're roughly 145, 150 people across the U.S. today.
All right. And the last question is, you're focused on patients right now. There's a lot of other, both messaging within health systems, obviously clinicians to clinicians. There's obviously a bunch of other, and you're in the hospital side, the hospital health system side, a bunch of other people who want to care about patients as well. And there is sort of a fight out there about who owns the patient.
Yes.
Where do you think you end up
Yeah, so
in
we're
the
in
next
the
little bit?
in the favorable position of one having depth of integration into electronic health record, but then also integrating up into the tech stack, right? So think call center, your CRM like Salesforce, your telehealth capabilities, your remote patient monitoring capabilities, and then increasingly your patient financial journey. So Luma has the depth of tentacles there, and others building on top of us, like payment players, population health players, etc. So we own that last mile to the patient. It's real-time automated text first, 65% plus response rate. You can't match that on any other channel. And so we have that favorable position, which allows us to do all the things we do, but we're now finding that other folks are involved in communicating around the patient, want to play nice with us, right? So for example, we can invite different clinicians, or PCP, a referring provider, a specialist of some sort, to have a conversation around the patient and then be able to pull in the patient or their loved one into that chat. Similarly, within a health system, different departments have to hand off to each other, but we do it around the patient at the center of the view, as opposed to 6 different departments trying to reach the patient. You have all your primary care outreach, your specialist outreach, but then the financial counseling office, right? The counselor who needs to engage with the family member about delivering care when the patient's at home. They're able to have that conversation internally, but around the patient at the center of everything they do.
All right, so the patient at the center of your messaging system. This is Adnan Iqbal. He is the CEO of Luma Health, and thanks for your time.
Thanks so much, Matthew.